Dr. Arwady, in the current funding bill, your center's funding is eliminated. That's pretty chilling after your testimony of what you do. I especially appreciate your saying, and I did not know this, that overdose rates fell in 2023 for the first time in 5 years. So how is this, what's going to happen with the elimination of your center?
It would be devastating for the work to prevent injuries and violence, including overdose and suicide, if this funding did not exist across the country.
Is there any other place in the federal government under HHS where this is tended to?
So we work across the federal government. A problem this big, like opioids, for example, requires multiple agencies. Our work at CDC is complementary. It is not duplicative. But at CDC, for example, it is our data systems that actually let us know what Americans are overdosing from today. It's the systems that let us have the real-time data. It's the systems that let us know how that threat continues to evolve. And importantly, it's the work that funds the frontline public health response to this threat.
I hope that on a quiet basis that my colleagues on the other side of the aisle will talk to some of their colleagues in their caucus about what they have recommended in their appropriation bill, because I think that this is devastating. This is an issue that on both sides of the aisle, members have been deeply, deeply concerned about and have experienced in their congressional districts, the number of deaths from overdoses. Now, in public health, and it's the case, I think, especially with AI now, good data is gold. And good data helps to predict viral outbreaks, detect emerging trends in illicit drug use, track diseases and wastewater. So to Dr. Layden, does the CDC have access to the health data it needs? And if not, what prevents the CDC from getting that data? How do we fix it? And another question, how do you respond to those who are concerned? I think all of us are always concerned about how that data is used properly. There are some, one of the concerns that's been raised by some members is how the CDC uses its data, and does it track people in their daily lives?
Thanks for that important question. So a few things. One, CDC in public health has been underinvested for decades. This has led to delays and gaps in the data that we need for national situational awareness and early threat detection. We've seen the benefit and the impact thanks to data modernization and COVID-related funds over the last 4 years. Tremendous progress in a very short amount of time, but there's more work to be done. We need continued and increased funding to ensure that not just CDC, but public health broadly can modernize the systems. The systems at the state, local level are the ones that collect the data, act in the front line, and then send the data to CDC. We need
so it goes from the local to
in the vast majority of instances,
the other
yes.
way around.
Yeah. So that continued sustained funding with so much of our funds going out to the jurisdictions needed to ensure that we have these robust capabilities. We also need data authorities. We do rely on voluntary reporting that leads to a patchwork of the data that does come to CDC. So when we want and need national situational awareness and early threat detection, having that secure ability to receive that data so that we can act and support the nation and our communities is critical.
Well, thank you again to each one of you. I'm going to submit written questions to you, and I think that each of you has done a terrific job today. I yield back, Mr. Chairman. Thank you for your patience.